We'll get started with a maintenance update from Miss Bengie Alexandre. How are you this morning, Bengie?
Oh, hi. Sorry. Thank you, John. So the maintenance update is window is on our NEMSIS website.
Are you sharing your screen?
Oh, are you not seeing my screen?
Uh, I see you, but I don't see your screen.
Oh, sorry. 1 second.
I see your camera. I actually don't see you. There you are.
Oh, geez. It's my Zoom. There we go. Are you seeing my screen now?
Yes.
So if you go to under technical resources on the NEMSIS website, you will see our NEMSIS maintenance schedule here. And since we're in the month of July, our maintenance window will be July 15th and the 16th here for quarter 3. If you experience any interruptions outside of those dates, please feel free to open up a help desk ticket from this link here on the bottom of the maintenance schedule or at the bottom right button where it says submit a help desk. And if you have any other questions outside of the NEMSIS maintenance window, you can always open up a help desk and we'll do our best to assist. Thank you, John. I didn't know it was in screen sharing. Thank you about that. Sorry about that.
No problem, Bengie. Thank you.
Okay.
Next up is Clay. I'll just let him go ahead and share his screen so I don't share mine.
Great, thank you. Make sure that that's sharing appropriately. Can you see my screen, John?
We can, yes.
Great. Hey, thanks for joining, folks. It's great to have you with us this morning. I've got 2 initiatives that I wanted to talk to you a little bit about and actually receive some feedback from you. So feel free to go ahead and raise your hand, and we'll take you off mute. Would love some comments. First topic is probably not comment heavy, but I'm excited to share the idea that we are initiating the National Facilities List solution project. We talked about this last summer at the annual meeting in Park City. Randall did a great presentation where he talked about the issues that are associated with maintaining national facility or maintaining a facility lists at the state level as facilities open or close or change names, and facilities on borders between states may have different codes associated with different states. How do we maintain a national facilities list that is easy for the state EMS data managers or others to upkeep and to share with bordering states? Randall did a great job of describing that the issues associated with that. And then we had a presentation by a nonprofit organization, Technology for Causes. Dr. John Kuchar is associated with that, and talked about a potential solution for the issue of developing a crowdsource type project where each of the EMS state data managers act as the moderator for that crowdsourcing in an effort to kind of ease the burden on state EMS data managers for maintaining those lists by spreading the love among other state agencies or professional organizations within their states in keeping those lists up to date. There will be 2 working groups that are associated with this project that we will be soon requesting participation in. One will be an architecture group where we would love to have vendors or others that are interested in how we might have the flow of those changes to facilities pass through the NEMSIS information system. And then there'll also be a users work group where we'd love to have EMS state data managers and others that may be involved in maintaining those lists on that call to make sure that we're developing a project or a product that is efficient and effective in keeping those lists up to date. So If you'd like now to indicate your interest in participating in this project, it will just be based on conference calls, and we're hoping to have an update at our annual meeting in Park City this summer. If you're interested in either the architecture group or the users group, I think Amanda is going to put in the chat a link to the help desk, and feel free to just indicate to Amanda that you would be interested in joining the architecture group, which will be working on the use cases and how will we make this build work with our existing software and systems, or if you'd like to join the users group, just to make sure that we're ensuring we have the right process flow for keeping those lists up to date. So feel free to join, and then we'll have an official notice go out soon. The second topic that I would like to cover is related to our annual meeting, and this will be the first presentation of 5 or 6 that will happen during these implementation calls before we meet together in Park City, actually in Heber, which is just the neighboring county. As you've probably seen if you've gone to the NEMSIS website and looked at our agenda, we are going to be developing a different structure to the meeting this year. It's going to be very work group heavy, small group heavy. They were calling pods. Each pod will represent an assortment of folks that are associated with the NEMSIS information system. Could be vendors, could be providers, could be state data managers. Each of these pods will be given a topic that they will work with this small group and have report outs during the 3 days of the meeting to come to a resolution or solutions for those topics. So next 5 implementation calls that will happen before our meeting, we're going to be going through one of these topics, familiarizing you with the topic, and potentially asking for your participation. If any of these are topics that you would be interested in participating, if you're coming to join the meeting with us. And so I'm going to begin with the first topic. I'll just show you a snippet of the draft agenda that we put together, the actual, practical agenda where people will be going and what they'll be doing. And you can see here from the snippet from the first day afternoon, right? We're really going to be working very tightly in these pods, working through the issue. What are the barriers to solution? What would be the value of coming to a solution on this issue? What value would it bring to our EMS providers or to our states? And we'll be breaking down these topics in great detail and filling out a number of forms to ensure that we're actually focusing on exactly the target issue that we want to make sure that we can come to a resolution on. You'll recall that we asked you to participate in a number of times into a survey as to what you think would be important topics that continue to burden you as a vendor or as a EMS state, a data manager. What about the information system continues to not be working very well and burdening your efforts and your work? So we received a lot of responses from folks, and then we've gone through the responses and tried to collect them into groups. This first group, which we've taken a number of comments as highlighted in yellow, is going to be an idea of a pod working to reimagine NEMSIS compliant testing. So there was a number of these comments that were related to topics that could be addressed through compliance testing. So a good example here is this. If we were to aggregate those comments that I showed that were in yellow, you said as vendors and as state EMS data managers and even providers who filled out the survey, there can be issues that can emerge after the initial testing. And what that translates to us is the compliance needs maintenance, not just a point-in-time validation. And so what will be the pod discussion to actually deal with that issue? Should we address compliance drift over time? So that would be an extension of what we're doing right now for compliance testing. How can we reimagine what needs to happen in regards to compliance testing to bring us up to date with the issues that we're facing within the industry now? I'll just go through some amalgamations of some other things that was said by the state or by the survey comments. Failures and warnings getting past the state data managers and other user reported issues are not always visible or resolved soon enough. A system may be technically compliant, but hard to use or to navigate or to troubleshoot. These will be the type of issues that this group would address. One item that we've added to this list to be considered is the fact that at the NEMSIS Technical Assistance Center, we're seeing a real uptick in the number of products that are coming in for compliance testing. We think that it's related to just AI-supported development, use of Claude, right, to take our XML structures and be able to build systems quickly. What does that mean if like a Flash product is brought to us and we test it for compliance and it sits on our list of compliance, right? It is the expectation of our customers that not only did it pass compliance, right, but do they have resources to support the software if there are questions or breakdowns by agencies who purchase it? Is there a rich enough resource list and a rich enough staff within this new product, right, to be able to handle any customer service needs? That's not currently included in our compliance testing, though I think that is an assumption that's made by people when they look at our list. So again, another idea for this pod to kind of expand this idea of what does it mean to be NEMSIS compliant. I'm going to stop there and just ask if just this quick conversation has cued any other major topics associated with an issue, right, or a topic issue related that could be related or could be somewhat resolved with a modification to compliance testing. Are there any other ideas among the folks on the call? Feel free to just raise your hand. Okay. I can't see for sure whether there are any other raised hands. I think that there probably aren't. Is that right, John?
I'm not seeing any.
Yeah, not yet.
Okay. Well, folks, we do want to make sure that we have the full scope in mind in regards to this pod topic. I'll just run through some additional slides that may cue some thoughts. We talked about this a little bit, right? That there's these current compliant issues that really aren't addressed by the current process that we're using. Flash startup products, even products now that contain very helpful AI components to ease the burden placed on our providers filling out reports. Is that something that we want to somehow cover in compliance testing? User reported issues, but between testing periods, and really even the usability of the product. Is that something that we want to delve into in regards to compliance testing? If we dig into that piece a little bit more, right, the idea of the user interface, right? We have reports in our survey, right, that they can be difficult to navigate. There can be a lack of error or warning notification for the state data manager that a record has failed, or that warnings weren't adequately presented to the providers. All these are kind of a UI kind of issue. So it kind of begs the question, right, that if we delve into these areas, we've got to be a little bit careful and determine how best to solve these issues. So for example, some of the constraints that we've had in the past is we have made a concerted effort in regards to compliance testing to avoid product attributes that may be sensitive or used for market innovation, right? So we want to make sure that the compliance testing, do we want changes or enhancements to the compliance testing to kind of infringe on this idea a little bit? Do we want to be looking at how difficult it is to use the UI? Another barrier is that we need to be careful that increasing the compliance testing intervals or the complexity of it doesn't become overly burdensome for first-time or repeat customers into the process, right? We want to make sure that it remains doable. And then, of course, we want to always maintain a compliance process that can be agreed upon and all states are happy with. And so there is not, this process where a product may need to be tested once at the national level and once at an individual state level. So it's a complex issue, and I think having a pod that is specifically dedicated to this topic will be incredibly helpful. So again, I'll ask if there's any questions about the topic, reimagining NEMSIS compliance testing, or if there's any questions about the pod concept. Okay. I'm gonna see if I can beg some responses, just because it will be important for all of us to make sure that we have a really firm understanding of what we want this pod to cover in regards to compliance testing. Chris, could you post a quick couple of questions that could be answered by folks in a survey? And let's bring up our first question if we could. I'll stop sharing. Okay, so this first question is, what issues do you wish NEMSIS software compliance testing could resolve? So again, even if you've stated to us an answer in the past, try rephrasing it. We'd love to have the ability.
Right, Jen has a question.
Yeah, thank you, Jen.
Right. So how to answer this question is kind of hard. So I'm trying to figure out which perspective we're supposed to answer it from.
Okay.
So if I'm a state, my wishes and wants are one thing. If I'm a vendor, my wishes and wants are another thing. And if I'm an agency, it's yet again something else. So are you asking us just from our own perspectives with what we wish compliance testing could resolve? Or I guess I'm trying to figure out what you're looking for from this group to get them to answer with.
Like, I can kind of help answer on that. So really answering from your own perspective, the whole purpose of these pods is to make sure that the groups are intermixed with the differing opinions and perspectives, so that we can all come together. We all have insight and we all know our one segment. Kind of going back to it, the key is the standard has grown, technology has grown, and just taking a look, generally the compliance testing process and what it means to be compliant should be evolving along with those emerging technologies that are out there. And, to answer that question again, we really want everybody to answer honestly and from their own perspective, because that's what's going to make these pods so valuable. Everybody has valuable insight.
Gavin also has a question.
Yeah, Gavin, please.
Yeah, and Clay, I don't think it's more of a question, but more just some perspective. I know y'all are trying to get some more feedback. So I think, obviously you bring up a good point. I think the current compliance process is more about, can you follow the NEMSIS standard? Can you readily, update the record if there are some changes? But I think something that we're not currently assessing for is how is the use of the product after compliance testing? What is the actual end user experience? Because I think it's one thing when you have the full attention of a vendor who is focusing 100% on compliance. But it's very different when a customer, one of their 10,000 customers has an issue, and it may take 2 months to get that ticket to a point of getting a resolution. So I think it's very hard for NEMSIS to be in a position of assigning a score. I think we at the state level have tried to stay away from that. But I would definitely recommend that some way to implement in compliance, what is the ongoing resolution process like when they don't have the full attention of compliance? So from the user perspective, if they start getting a, XML failure, they, input a support ticket, what does that process look like? And is there a rigid enough response framework in place? So I think that's my feedback, if we're going to kind of delve into looking at that component. But I think it's very hard to assign a score. And I think it would put us as a state and I think NEMSIS in a very precarious situation. So that's just my 2 cents. Appreciate the time.
Yeah, thank you, Gavin. Very good points, right? And that'll be important to this pod to be able to balance those issues. So yeah, thank you, Gavin. And thank you, Josh, for your comments as well. Other comments?
So, Clay, there was an issue with the poll anywhere, but it is now up. So if your screen's not refreshed, or if you haven't noticed, there's now a QR code at the top right of your screen you can use to vote. Thank you, guys.
Oh, great. Thank you, John. Yeah, sorry about that.
Yeah, there's also a link in the chat if that's easier.
Great. Super. So yes, please go ahead and use that feature. We'd love to have your written comments if you'd rather just provide a written response. The second survey question that I wanted to bring up, I mentioned a couple of constraints that this pod will consider. Gavin mentioned another, a potential constraint that will be used to kind of guide their discussions and improving our compliance testing process. Are there other constraints that you are feeling as a vendor or as a state EMS data manager? There'll be a second poll question related to this. Are there other constraints that we need to consider or that you feel, right, that is keeping you from having your system working the way that you want it to, either as a vendor or as a state EMS data manager? Are there other attributes or like boundaries associated with the current compliance testing or the results of the compliance testing that you want to make sure that this group considers? Any additional, feel free to add those. Any other verbal comments that folks want to make in regards to constraints or barriers around the idea of modifying our compliance testing process?
Then you should be good to speak up.
Okay, great. Yeah, great comment provided. Yeah, thank you for the comment regarding relabeling. Incredibly valuable. Thank you. Lack of consistency between the numerous states data sets. Thank you. Yeah, good comments.
And Clay, Jen has her hand raised. If
yeah, Jen. Yeah, great to hear from you, Jen. Thank you.
One of the things that I've seen is that there'll be a vendor listed as compliant, and yet it's not available to their customers yet, right? So if I'm a customer and I'm going to go to the website to make sure that they're compliant and they passed all of their testing, but when I want to implement those things, they are not available, right? Or they're still using custom versions. Maybe if there was custom stuff made to, and yet that came out in 351, for example, that they're still sending it with the custom rather than sending it in that new version pattern. And I don't know if that can be part of the compliance testing, where that's a question that they have to certify that it is available to be used by the customers once it's on the website.
That's a great comment, Jen. Yeah, thank you. Yeah, I hope, Jen, that you'll consider this pod and that you'll be joining us. You have such great experience with this, working with the NEMSIS TAC on compliance. So thank you, Jen. Your thoughts will be incredibly valuable. Okay, we got some great comments coming in. Thank you. Thank you so much. I appreciate the time that you're putting in. We will make sure, I'm kind of reading these as they go. These look great. So feel free to continue to make those comments. Any comments you make will be brought to this pod. I'm going to end my section here with one other request. Please continue to provide comments here. This is so helpful for us. But also, if you're interested in joining this pod, if this is a particular area where you would potentially have interest when you attend our meeting in October, clearly there are probably 4 or 5 other pod topics that you'll hear about over the coming weeks. But if you have interest in potentially participating in this pod, I think Amanda is going to put in a help desk link. I think she already did. She put in a help desk link. Maybe you could put it in again, Amanda, just to be at the bottom of the comments. If you have interest in joining this pod, would love to know that, and we can just begin to continue thinking about what might be the constitution of each of these pods. Clearly, you may hear of a topic that's coming up that we're presenting to you in the next call, for example, where you may want to be involved in that topic more than this topic. That's fine. We'll work through all those issues. But if this piques your interest, if you have an interest potentially here, we'd love to know about it. We can begin to look at the constitution of those work groups in each of the pods. So yeah, thank you for the comments. And please feel free during the call to continue to put in those comments. Those will be incredibly valuable for us. Thank you. John, I'll turn it back over to you. Thank you for the time.
Right. Thank you. Next on our agenda is Mr. Chris Hoffman with a monthly research highlight.
Awesome. Thank you, John. Let me see if sharing here is difficult. Let's try
I think we're already seeing the screen. There we go.
There we go. Perfect. All right. Thank you so much, John. It's always my privilege to present the monthly research highlight. For this month, we are looking at a study that explored the statewide coordination centers, or explored statewide coordination centers and their impact on hospital transfers. One of the requests from our stakeholders was to see where the research is being used or where the data is being used in research. And so we post on social media and send out an email. This one has not gone out yet. It will be going out shortly, and it is in a format that's easily shareable, printable, so it can be posted in a break room or shared amongst anyone you think is interested in this information. If you want to see these research highlights and other things that are going on with the NEMSIS TAC, feel free to find us on your favorite social media website. Look for NEMSIS TAC, and you will find this information plus other information about events and things that are going on with the NEMSIS TAC. Yeah, watch for these. Watch for these every month, and yeah, feel free to share those to everyone else. And I think that's it for the monthly report. I'll hand it back to you, John.
Thank you. Next up is the monthly report presented by Ms. Monet Iheanacho.
Okay, thank you so much. Can you hear me okay?
We can.
Fantastic. Greetings, everyone. Thank you so much for being on the call today. We really appreciate your participation. I am going to highlight the monthly report, and I want to actually show you how to find it in case this is your first time on the call. It's a report, so you would go to the tab that says View Reports, and it is a public report, which means anyone can access this report. This is the monthly report that we're talking about, and so you would click on that box. And right here at the very top, it says June report. So basically, this report highlights the work that the TAC is doing, any current initiatives. However, it's not all inclusive, but it does provide insight to some of the initiatives and projects that we're working on. One of the things that I want to mention is that at the very top of the report, these numbers will always change each month because we're counting the data that is being received in the warehouse. And so that might be valuable for you. The other thing I want to mention briefly, and we did have some discussion related to the annual meeting, and I want to thank Dr. Mann and others for your comments about the pods. But we do have the registration open. The links are here. And again, those pod discussions that we briefly talked about today, we want to include all of that great information at the meeting. So please take the time to go ahead and register for the meeting and also to reserve your rooms. One thing I will mention at this time is we only have 20 rooms available in the NEMSIS group block. And so if you will be attending the meeting, please go ahead and take care of your reservations because this is really the only venue in that area that you might want to secure for the meeting. You might be a little further away if you miss that opportunity to get your room reserved. So I'm going to just plug that again. And then I'll just continue to show you some other things that's happening in this report. So for instance, some quick links to very previous V3 calls. We also have some information about the previous public trainings in case you missed it and can't seem to find that information on the website. We also have the information about the blood transfusion report, as well as these numbers here constantly change in the report. So again, I know the report looks very similar to what we published last month, but these numbers are constantly being updated because we want you to know the count of records for the 351, 35, and we still have records coming in for 34. And this particular information was requested by either a state data manager, a director, or someone who found value in this information. So we'll continue to post this information so that you have it readily available. I also thought about who would best benefit from this report. And if I was a new employee to a state EMS office, this would be an ideal report for me because I want to get a quick high-level overview of the NEMSIS project. So this is a report that you could easily share with others on your team. We also have several other research publications utilizing NEMSIS data, so you definitely want to check that out and share that information with others. And please just keep, informing us if there are things that we should modify in the report, because this report is for you, and we want to make sure that you find value in this report. And I also appreciate hearing Jen's comments about the software compliance and the information that we post on the website. So we're always aiming to do better, and we can do better with your support. And so I just want to say thank you for all that you do. I hope that you're staying warm and or staying cool rather. And I want to say have a blessed rest of your day, and I'll turn it back to you, John.
Thank you, Monet.
Thanks, Monet. Can I interrupt real quick, John?
Sure.
I know Clay mentioned earlier, we have received lots of feedback from people of ideas of problems to solution at annual meeting. Thank you for everyone who has completed that. I think we had at least 25 or 30 people, but we're going to share the link again. If you have already completed it and have new ideas, or have not completed it and have ideas of things you would like to see be a potential pod topic at our annual meeting, now that you kind of see and maybe understand better what those pods will look like, Misha just put a link to that survey. And so it is still open, and feel free to fill it out multiple times if you already have. And we will continue looking at those responses. So thank you. Thanks, John.
No problem. Thanks, Laura. Next up is Mr. Randall Eimerman with the next three topics. We're seeing your screen, but we're not hearing you.
All right. How about now, John?
You sound great. Thanks.
All right. Thanks. So I just got 3 topics here in a row. They'll be very quick. I don't expect too many questions or comments. Once again, open to them if need be. So first one, just a quick NASEMSO liaison update. Some quick meetings here. Data Manager Council meet July 21st and July 28th is the business meeting and the working meeting. Those meetings do occur every month. And then also we have just a kind of a quick brief about our virtual regional meetings. So each one of the NASEMSO regions, they do meet virtually every other month. I think the Great Lakes meets every month. So we are divided into 5 different regions. Here we kind of see like Western Plains, Amber Vietnan sort of does a report out for us. West region, we have Ann Vosbrink. East region, Chip Cooper. South region is Brittany Outland. And Great Lakes is Ella Dulski. So very familiar names. And they really have an added responsibility of taking a lot of this information that we work on with the data managers, also within NEMSIS. And they pass all this information over to the regions. On those regional calls, there's pediatric emergency members, there's licensing members, state directors, the data managers, of course. So different variety of members from each of the EMS offices. So one of the things that we sort of heard feedback from them was that the data managers actually come with quite a great report. They have a lot of material, and sometimes it just sort of gets lost with all the other information during that meeting. So Monet had just done a really great presentation on the NEMSIS monthly report, and that's another object that we try to get over into those regional meetings. So the data managers have been sort of working on and not yet finalized sort of a report to for those regional representatives to bring to those meetings, leave a record, have the links, have all the documents so that it's sort of all in one place. So just a better way of getting that information and all the work that we complete over. So that was just a quick update on sort of what the how we move that information from NEMSIS into the NASEMSO EMS offices. Next topic here is just a reminder for the Violence Against EMS Personnel quarterly information sharing session. That QR code, once again, does lead to the interest form. For anyone who has filled that out previously, the invites did go out. If you did not receive an invite and you were expecting it, please feel free to reach out to me. I'll make sure you get that. The first meeting for violence will be next week, July 15th. Another informational sharing session that we have is the CPMIH National Custom Data Elements. Once again, the invites did go out. If you had filled out the interest form, the first meeting for that one is August 19th, 2026, and then 3 additional meetings went out for that one. So once again, if you did not receive the invite and you were expecting to, please feel free to reach out to me. And we will also be sending both of these meetings over to NASEMSO to see if we can get any additional members from the NASEMSO EMS offices that don't necessarily participate in this call. And then my last topic here is the National Custom Elements. Last week we presented the informational document on the National EMS ID. That has been now posted to the NEMSIS website by following the technical resources to the custom element library. You'll see it's number 5 there. Worked very closely with the EMS Compact and the NREMT to sort of add some additional language here so that we could all understand the benefits of that number. So, just another example of trying to break down some of those national custom elements, make it easier for the vendors, the clinicians, the data managers, everyone to see them. And for each of the different categories, that list has become long again now that we've added the community paramedicine custom elements. And that's all I have for today, John. Any questions?
I don't see any. Thank you, Randall. So next up is a reminder for our upcoming meetings. So our next implementation call is July the 22nd, and then we'll have a public training on August the 4th. And then our first meeting for August will be the 12th, which brings us now to the open forum.
Hey, John,
yes.
there are some questions in the chat for Randall. Or in
I see
the Q&A for Randall. Yep, they just popped up.
Yep, I see it. So Randall, first question, are EMS agencies allowed to be on the virtual regional meetings? How could someone get added to those if the answer is yes?
The answer for that one would just be no. So that's for the NASEMSO members only. And it just sort of represents the state EMS office.
And James Fox from San Diego asks, when is that compact document going to be available?
It is available now on the NEMSIS website and the custom element library underneath the informational documents. It's number 5.
Okay. Great. Thank you. So back to the open forum. It's an opportunity to raise questions and share feedback or flag topics related to today's content. You can submit questions through the QA or raise your hand, and we'll moderate to keep us on time and make sure we capture anything that needs follow-up. Not everybody at once. All right, I don't see any questions coming in the Q&A or any hands up. So before we wrap up, we'd like to invite you to follow NEMSIS on social media to stay up to date on V3 updates, resources, upcoming announcements, and research highlights. You can find us on Facebook, LinkedIn, YouTube, and others. Just search for NEMSIS-TA or NEMSIS space TAC, NEMSIS TAC. So thank you all for joining today. We appreciate you taking the time out of your day to join us. We are very busy and we appreciate your time. Our next meeting is on July the 22nd, same time, same place. And we look forward to seeing you. So if this time, last call for questions or QA, we'll move to the breakout rooms. Before we do that, just a quick reminder, vendors need to join their assigned breakout room to receive credit for attending today's call. Please join only your designated room and do not enter other breakout rooms without permission. Keep conversations professional and respectful. You should see a prompt to join your assigned breakout room in just a second. When you see it, click join. If you have any issues, TAC staff will remain in the main room to help. Thank you, everybody. Thank you for your time in this meeting and have a great rest of your day.